Did you know that January is Cervical Cancer Awareness Month? Most cervical cancers are caused by persistent infection with human papillomavirus, which you probably know as HPV. And in the United States, there were an estimated 13,820 new cases of cervical cancer diagnosed in 2024. Today, I've invited GYN oncologist Dr. Lisa Abaid to share some expert information about cervical cancer with us.
Hi, Danielle. Thanks so much for having me.
Anytime. Is cervical cancer treatment a big part of what you do as a gyn-onc doctor?
Yes, it is. Cervical cancer makes up a significant portion of the patients I treat, and this treatment can include surgery, radiotherapy, and chemotherapy, which, as you know, can suppress the immune system and make my patients far more vulnerable to infections.
Yeah, cancer and its treatments can lead to immunosuppression. What do you recommend for your patients undergoing treatment for cervical cancer so that they can avoid potentially dangerous infections during their treatment?
Yes, so I tell my patients what the guidelines suggest, which is that while undergoing chemotherapy, their immune system might suffer from it, and it's important to prepare in advance. Receiving non-live vaccines is one of the things we consider before starting treatment, including COVID-19, RSV, influenza, excluding the nasal mist form, and shingles.
For those of you who don't know, anyone previously infected with the chickenpox virus, also known as the varicella zoster virus, can develop shingles.
Yes, exactly. When you get chickenpox, VZV develops latency in your nerve cells and can later reactivate, causing shingles, which typically presents as a very painful rash that lasts for 2 to 4 weeks. The risk for reactivation increases with age and in people with weakened immune systems.
And more women than men seem to develop shingles too.
Yes, that's right.
That must be really difficult for patients who are already undergoing treatment for cancer. How common is shingles amongst these patients?
Yeah, it's incredibly difficult. The incidence of shingles is particularly high the first 2 years following cancer diagnosis. Adults on immunosuppressive therapies can develop more severe, longer-lasting rashes compared to immunocompetent patients and are more likely to experience complications from shingles. So my patients undergoing chemotherapy for gynecologic cancers are at a greater risk of shingles. Also, radiation therapy may increase the rate of VZV reactivation due to compromised cell-mediated immunity. This reactivation can cause interruptions or can prolong the radiotherapeutic course.
And what about cervical cancer specifically?
Evidence on incident zoster risk in specific malignancies is limited. A UK case control population-based study that looked at HZ after 21 specific malignancies showed that there may be an increase in the incidence of herpes zoster in patients with cervical cancer. However, it wasn't statistically significant, but I do see it. I recently had a patient on chemotherapy who had a terrible zoster rash that involved her scalp, her face, and her eye. We were able to treat it without her losing eyesight, but she was hospitalized for several days, and we had to delay her chemotherapy several weeks to allow her immune system to recover. Studies have shown that delaying cancer treatment can compromise its efficacy, so this was a very unfortunate situation.
Tell me more about these complications. As we've discussed here before, it can cause postherpetic neuralgia, which is a nerve pain that can persist for months or sometimes even years after the initial rash has resolved.
Yes, postherpetic neuralgia occurs in 10 to 18% of patients with shingles. 10 to 25% of cases present in or around the eye, like in the patient I mentioned. This is known as herpes zoster ophthalmicus, or HZO, which on rare occasions can lead to vision loss. Other rare complications of HZ include hearing loss, encephalitis, and even pneumonia.
As if undergoing chemotherapy isn't enough, getting shingles and possibly a complication on top of it seems unimaginable. Since we know from the data how significantly shingles can impact a person's quality of life, is there anything that you recommend for preventing it?
Yeah, a prevention of the reactivation of the herpes zoster virus is the only well-documented means of preventing shingles and its complications, and the CDC recommends herpes zoster vaccination for the prevention of herpes zoster and related complications in immunocompetent adults age 50 and older, or in adults age 19 and older who are or will be immunodeficient or immunocompromised because of disease or therapy.
As a healthcare professional, I work hard to educate on best practices for health. Let's make sure physicians and patients are aware of shingles, its complications, and its preventative measures. Lisa, thank you so much for taking time to educate my audience on this very important topic.
You are so welcome. Thank you for having me.